Hello friends, I am Dr. Sushil Ahire, consultant pathologist with Krsnaa Diagnostics Limited, Himachal project. Friends, are you sometimes worried about forgetting things or difficulty in concentration or slower decision making as you grow older? We normally think memory loss is related to age. Yeah, it's true to some extent. But what if I told you that few very simple blood tests, if they can point towards any cognition deficit years before the symptom appear? Yes, it's true. Simple test or blood test like vitamin B12, homocysteine, and lipid levels can give us some idea regarding our brain health. Let's understand these three parameters in simple language. Vitamin B12 acts as a fuel to our nervous system, the basic unit known as neurons, because it is useful in myelination of the nerve fiber so that there is smooth neural transmission. Also, it helps in neurotransmitter preparation. Low amount of vitamin B12 can lead to problems with nerve condition and thereby cognitive deficit like brain atrophy also. Homocysteine, you can consider this as a toxic byproduct. Vitamin B12 along with folate and B6, they recycle homocysteine into harmless compound. So if the B12 levels are low, the homocysteine creeps up and it might lead to vascular damage, thereby less blood supply to the brain and also oxidative stress. It might lead to more chances of Alzheimer's. Lipids, as you know, we call it as cholesterol in simple language. They are more related to heart health, but 60% of brain is composed of fat, and a very healthy lipid balance has to be maintained there. LDL, low density lipoprotein, we call it as a bad cholesterol. If it is high, HDL, high density lipoprotein, which we call as a good cholesterol. If it is low, then it might lead to again vascular insufficiency providing to the brain and then thereby decline in cognition function. So these three parameters, low vitamin B12, high homocysteine, and deranged lipid, these lead to vascular and neurological damage. So yearly checkup of all these three parameters should be insisted. Many of the labs do consider 200 picogram per ml as normal, but neurological studies do suggest that we need to maintain more than 400 picogram per ml of vitamin B12 for better cognition. Homocysteine more than 10 to 12 micromole per liter could be a risk factor, and then 5-point increase in rate might lead to dementia. So high levels of LDL, low levels of HDL, high levels of triglycerides, high levels of LPA, that is lipoprotein A, could also lead to vascular insufficiency to the brain and thereby the brain function. LPA can be assessed in extended lipid profile. Metabolic brain health snapshot is what these three parameters are known as. Even if deranged, there are very simple correctional solutions like adding vitamin B12 supplements either orally or parenterally, that is through injections, of course with the advice of your doctor. Adding green leafy vegetables, eggs, fruits in the diet. Maintaining a low fatty acid diet. Adding omega-3 fat into the diet. Moderate amount of exercise is helpful. So protecting brain health before it asks help is what we should look into. Thank you very much.